start yet? Or
Good morning. Today we're going to report about a new differential diagnosis of dysphagia, a case report for lymphocytic esophagitis. Lymphocytic esophagitis is a rare condition wherein the esophagus are inflamed and there is a containing a lymphocytes. So that is the lymphocytic esophagitis. And for the dysphagia is usually defined as difficulty swallowing. So wherein it takes more time and effort to move the food or liquid from your mouth to your stomach.
For the patient information, the name is Amy Martin, age 71, gender is female, the race is Caucasian, residency of Sayat Nova Avenue, Kentron District, Yerevan, Armenia. Referral sources or reason for referral, Armenia Republican Medical Center. It is the patient's hospital choice. And for the patient history, there's the chief complaint is dysphagia or difficulty in swallowing for solid foods. And the history of present illness is lymphocytic esophagitis caused by chronic esophagitis. For the medical health history, the patient have arterial hypertension, osteoarthritis, and incomplete crest or calcinosis, Raynaud's phenomenon, esophageal dysmotility, sclerodactyly, and telangiectasia syndrome. For the past surgical history, there is no enough information. And for medication, the patient take glucosamine, calcium supplements, and amlodipine 10 milligrams, and esomeprazole 40 milligrams, and take once daily. Allergies, the patient don't have any allergies.
So for the diagnostic plan, the diagnostic workup started in endoscopic study. So the endoscopic study uses to look at the inner lining at the upper digestive tract, the esophagus, the stomach, and the duodenum, which is the first part of the small intestine. The second is the esophageal manometry. Esophageal manometry is a test that is used to measure the function of the lower esophageal sphincter. The valve that prevents reflux or backflow of the gastric acid, and the muscle that is and the muscles of the esophagus. Next is the barium swallow. This is the test done to look for the diagnose problems in pharynx and esophagus. The last one is the esophageal biopsy. It is natural extension of endoscopic evaluation of many patients. It has high likelihood of diagnostic accuracy in malignant and infectious esophageal disease. For the result of the endoscopic study, endoscopic study was performed to achieve mucosal sampling and try to surpass the stenosis. They used 55 mm scope, and the mucosa of the proximal esophagus shows trachealization with no other relevant alterations. The stomach and the duodenum was normal. For the next slide is the esophageal manometry. Esophageal manometry shows this motility of the distal 2/3 of esophagus. This motility is a condition in which muscles of the digestive system become impaired and changes in the speed. Next is the barium swallow study. The barium swallow study did not reveal any esophageal diverticula, stenosis, or hiatus hernia or signs of esophageal motility disorder. The last one is the esophageal biopsy. The esophageal biopsy revealed mucosa with a stratified squamous epithelium with lymphatic infiltrate and a peripapillary distribution and stenosis. No granulocytes were observed. So the treatment they used, the patient started esomeprazole 40 milligram once a day for 4 months. Later, she referred symptom improvement, being able to swallow solid food, complaining only for a heartburn. So the next is acid. So the patient complained for heartburn. So the doctor gave acid suppressant therapy and then follow up the general surgeon for another endoscopic procedure and repeated mucosal sampling schedule for 1 year after the initial evaluation. Thank you.
So for our conclusion, a 71-year-old Caucasian female patient was presented to the general surgeon complaining of dysphagia. So the diagnostic workup started with an upper endoscopic study and esophageal manometry, but the endoscopy was incomplete due to the stenosis, which did not allow the passage of the standard endoscope, so no biopsies were taken. So the patient was then referred to the general surgery appointment and an endoscopic study was performed to try to surpass the stenosis and achieve mucosal sampling. Biopsies were taken from the stenosis and the adjacent mucosa of the esophagus. So the mucosa of the proximal esophagus showed trachealization. Also, a barium swallow study and manometry were performed. The pathologic study concluded that there was a chronic inflammation of the mucosa compatible with lymphocytic esophagitis. So the patient was treated with omeprazole and acid suppressing therapy. It is the most commonly applied strategies because it helps in improving the symptoms. So all in all, the endoscopy, barium swallow, as well as the mucosal sampling are essential to the diagnosis. The diagnosis requires a high index of suspicion since its symptoms are non-specific and there is no age or gender predilection. So that is all for our case study. Thank you.